So section 11.1, health insurance premiums. And of course, we're going to learn about them. Here's a couple of questions that by the end, you should know what the answers are. One of them, what if your employer doesn't offer health insurance? Do you really need it? So we'll go back and do that one for sure. Also, should you save money by not getting health insurance? So let's learn a little bit about it, and then we'll go back to those two questions before we're done. Health insurance protects you against overwhelming medical expenses. Accidents and illnesses could take away your income, deplete your savings, and leave you in debt. Here's some of the kinds of insurance. The traditional plan, healthcare coverage where the healthcare provider is paid a predetermined dollar amount for the service given. For instance, if you have your appendix out, they have a little list of things. They'll say appendix, they will pay this much. That's it. So if you get it done in the state of North Dakota, no matter where you go, this is how much that insurance company will pay for you to get your appendix out, you know, or whatever surgery you happen to have. PPO, Preferred Provider Organization. You have to know what those three letters mean. On the test, I believe it's just PPO. You have to know what it is and probably how to explain it. This is a group of selected healthcare providers who offer comprehensive services at preset reimbursement levels. So basically, it's a group, but they only still cover a certain percentage or a certain amount. So all of the insurance companies cover up to a certain amount, and then you would have to pay for part of the rest. For this one, you have to use the network providers. So we were actually in one like this a few years back where we had to either choose Sanford or Essentia. And then you would go to those doctors which were in that network to get anything that you had done. However, if that network didn't have the medical personnel that you needed, they would refer you over there, and that's a different story. So if you actually just had something done, you would have to go to Essentia and then kind of go through that route, or Sanford, whichever one you picked. If you actually went with a non-network provider without going through the proper channels, then you'd have to pay more. It didn't mean you couldn't go to someone else. It's just that you would pay a little bit more to do that. And the last type, Health Maintenance Organization, or HMO, a prepaid health plan in which care providers contract with or are employees of the HMO. Here you select a primary care physician, and then all of your doctoring would go to that person unless they needed to refer you to someone else, so to some other specialist. So the HMO, you're looking for a primary care physician, so you go to a certain doctor. With this one back here, you're going to the certain network. So you're going to Essentia, Sanford, whatever. So they are just slightly different. A lot of insurance is very confusing. So I'm going to go back to these first couple of questions. When a few years back, did you have to have health insurance? When Obama was president, you had to have insurance. That was like a law. So everyone had to prove that they had health insurance. Right now, is that a law? No. So you don't have to have health insurance. There are places that you can go to, I think, get cheaper health insurance, so you need to look around a little bit. But here, what if your employer doesn't offer health insurance? Do you really need it? No, you don't need it. But if you have something that requires surgery or, you know, something like that, these expenses can pile up super, super quickly. So you don't have to have it, but it sure is nice to use it if you do need it. I kind of feel like health insurance is one of those things that if your employer does offer it, and even if you have to pay some of it is better than nothing. I'm going to give you an example. Okay, so obviously you guys know that Asha has cochlear implants, right? When she had that surgery, I think the surgery alone was over $350,000 just to have the surgery. So do you think without insurance we would have been able to do that? No. She just got okayed for new processors. Her processors for $22,000. So again, if we didn't have insurance, we would have to pay $22,000 in order for her to hear. We do have insurance, So we end up paying under 5, I think. But even so, 5's a lot, 5,000's a lot. But when you look at 22,000 versus 5,000, well, that's a big deal. So, you know, just so you can kind of put it into perspective. You know, obviously not everything is that expensive, but what if you break your arm and you end up having pins and surgery and all that kind of stuff? The doctor bill, the hospital bill, maybe you have to stay overnight. All of those things kind of rack up. So obviously you want to not have to use it, but if you do, it's sure a nice little cushion to have just in case you need it. Should you save money by not getting insurance? I would say if you can have insurance, have insurance. If you can't afford it, that's another story. You just have to do what you have to do. Some people say, well, I'm not going to get insurance, but I'm going to save money. I'm going to put money aside just in case I have something happen. How many people do you suppose do that? Probably not very many. If you do, that'd be great. But if you put money aside, it's easier to take that money out when you think you need it. So the one thing that's good about insurance, if your employer does have it, and they take it right out of your check, you don't even miss it because you never have it. They take it out before you even see your check, and that's kind of the good thing about that. So I'm not saying, you know, one way or the other. For me, insurance is kind of a necessity. For others, maybe it isn't. So you guys kind of take that with whatever you want. Here's your example. Examples are super easy today. Sean has a family membership in a group medical insurance program. Again, us through the school, we're in a group, so we pay less money than we would be if I was like alone paying my insurance just out of pocket. The annual premium is $11,880, so that's how much they pay for a year. His employer pays 80% of the total cost. So Sean's employer pays 80%. He would then pay, oops, I don't like that color, just a second. 100 minus 80 would be, 80 would be 20%. So employer pays 80%, Sean pays 20%. What's his annual contribution? You take $11,880 times his contribution, which is 20%. You multiply them, and you get $2,376. So for a year, Sean would have to dish out $2,376. Then it will break it down into how many paychecks is he going to get. So for this one, they get a monthly paycheck, so it's $2,376 divided by 12. So monthly, Sean would pay $198. Okay, now his employer then would take out $198 out of every single check. And again, like I said, if they take it out before you see the money, you don't even notice that it's gone. It's just one of those things you just kind of have to bite the bullet and just pay for it. So here's some other things that you might run into when you're doing these. So obviously we just did monthly. Monthly is 12 times a year. What's semi-monthly again? We haven't done these for a while. Oops. Semi-monthly actually means twice a month, so it would be 12 times 2 or 24. How about weekly? How many weeks in a year? 52. How about bi-weekly? Nope, every other week. So 52 divided by 2, so you'd have 26. I think that's all that you'll run into. I know I saw some bi-weekly ones and possibly some semi-monthly ones. So keep these in mind. I will download both of these. You'll have the video online. You'll also have the notes online. So in case you forget, you can sure look them up there. Make sure that at the beginning you subtract the percent from 100. It always gives, or I'd say 99% of the time, it's going to give how much the employer pays, not how much the person pays that you're trying to figure out their stuff. So make sure you subtract from 100, then multiply, then divide by whichever number that you need.